And when we took the deep dive into research, because that's, I think been part of the lag in the use of massage therapy in, let's say, more medical clinical settings, is the dearth of research that's out there to support both the safety and the effectiveness of massage therapy in a variety of sort of presentations and settings. So when Nancy and I were preparing to write the book, we wanted to make sure that the book was well supported by the available research that is out there, not only massage therapy specific, but in the broader community of good wound healing research that helps inform how we use our hands throughout the various stages of wound healing. And interesting, when we were doing the research for the book, certainly we saw in the medical literature, it was quite common to see that the patient self-care instructions included massage the scar. But there seems to be a paucity in referrals or direction or guidance to seek out massage therapy or manual therapy professional assistance for after surgeries to help the rehab process. And so that's really what the book is about, is how that we can support that care for that patient. So the world's who's who of wound healing seem to all agree that there are two primary drivers of overexpression of collagen production, and one is excessive or prolonged inflammation, and then the other is premature and anomalous tissue tension. So that's the way that Nancy and I approach working with already formed scar tissues, that we're not looking to try and break this tissue down, but there are potentially ways that we can change the pliability, the organization, and other features that we see with fibrotic collagen. And just to make a quick note, and again, in doing the research, one of the things that Nancy and I sort of quickly clued in on is anomalous collagen is the common physical characteristic of all types of scars. So whether we're talking about on the skin surface hypertrophic scars or keloids, or deeper into the tissue, the remodeling that takes place, the common physical characteristic is fibrotic collagen. So we could be talking about frozen shoulder, or we could be talking about post-surgical, or we could be talking about some kind of repetitive strain or overuse injury, and fibrotic collagen is a common element in all of those things. So when I'm working with those types of issues, much of what I'm doing with my hands is very similar across the board with those variety of issues. Certainly there are some additional considerations. Keloids, for example, very different than hypertrophic scars, so the way that we would approach working with that would have some differences, as well as radiation-induced fibrosis. So there are those other elements to consider for sure, but the common physical characteristic is fibrotic collagen. So that's there's some research that Nancy and I just mentioned a bit. There's a lot out there, but just a couple research done by Dr. Jeffrey Bove and a massage therapy colleague of mine, Susan Chappelle, working with, and this is animal-based research, working with post-surgical abdominal work very early, like soon after surgery, and how gently and safely moving tissue around helps to keep it from forming adhesions or getting stuck in the first place.